What's up? Time Talks Med here. Let's continue our cranial nerve series. Cranial nerves are 12 pair of nerves that exit the brain and the brainstem. And in this segment, we will talk detailed about the 12th cranial nerve, the hypoglossal nerve. And we will do that by first drawing a quick scheme of the hypoglossal nerve pathway. We'll talk about the distribution of nuclei and the course of this nerve, and then go through the branches and its associated nerves. Awesome! Now, the hypoglossal nerve is relatively easy. It's purely a motor nerve responsible for controlling the movement of the tongue, which means that it plays a crucial role in tongue mobility and articulation, making it essential for speech and swallowing. The hypoglossal nerve originates from the nucleus of the hypoglossal nerve, located within the medulla oblongata. This nerve is going to give off somatic efferent fibers, or motor fibers, that are going to go out from the brainstem in the sulcus between the olive and the pyramid. We call it the pre-olivary groove. It then travels a short distance within the cranial cavity and then exits the skull through the hypoglossal canal. As the nerve is now outside of the cranium, it travels between the internal carotid artery and the internal jugular vein to then form an arch we call the arch of the hypoglossal nerve. It then goes towards the tongue and give off the lingual branches to supply the muscles of the tongue, which primarily include the extrinsic muscles, the genioglossus, styloglossus, and the hypoglossus, and the intrinsic muscles, which are the superior and the inferior longitudinal lingual muscles, and the vertical and the transverse muscles of the tongue. The hypoglossal nerve is closely related with the cervical plexus, in that the anterior ramus of the first and second cervical spinal nerves are going to send some motor fibers towards the hypoglossal nerve that travels with the hypoglossal nerve to supply the geniohyoid muscle. When you study the hypoglossal nerve, you might find some variations that mention a meningeal branch coming from the sensory spinal ganglion of C2 that also might run through the hypoglossal canal and help innervate the dura mater in the floor of the posterior cranial fossa. The hypoglossal nerve will also send some motor fibers along the superior root of ansa cervicalis that go together with the inferior root of ansa cervicalis from the C2 and C3 to form a nice loop called ansa cervicalis. So that is the general scheme of this nerve and its associated branches. Now what I want to do is go through this nerve in a little more detail, and we will start with the nucleus. So here we see the spinal cord, the medulla oblongata, cerebellum, pons, mesencephalon, and the diencephalon. If we now go ahead and focus only on the lateral aspect of the brainstem, we can see that the nucleus of the hypoglossal nerve is located within the medulla oblongata. The nucleus of the hypoglossal nerve is going to give off a series of rootlets that are going to go out from the brainstem in the pre-olivary sulcus, so between the pyramid and the olive. If we now change it up with a little more realistic view, you will see that the rootlets leave the brainstem between the olive and the pyramid. Now, what happens is, this nerve is going to travel within the hypoglossal canal, as you see here. And through the hypoglossal canal, it's going to leave the cranium. When it leaves the cranium, it will pass between the internal carotid artery and the internal jugular vein, as you see here. Then it's going to form an arch as it passes forward towards the tongue. When it reaches the tongue, it will give off the lingual branches that's going to supply several muscles in the tongue. The muscles that it's going to supply is the styloglossus, which causes retraction of the tongue and elevation of the body and apex of the tongue. It will innervate the hypoglossus, which causes depression and retraction of the tongue. It's going to supply the genioglossus, which causes protrusion and depression of the tongue. Another small muscle it's going to innervate is the chondroglossal muscle, which is a tiny accessory muscle that helps with depression of the tongue. Alright, so the hypoglossal nerve will innervate the extrinsic muscles of the tongue. Now, if we cut the tongue in the middle, and then look at the tongue from this perspective, we will be able to see the muscles within the tongue itself. And those muscles are the superior longitudinal lingual and the inferior longitudinal lingual muscle, involved in shortening the length of the tongue. There's the vertical lingual, involved in flattening and broadening the tongue, and there's the transverse lingual, which narrows the tongue. These muscles are categorized as the intrinsic muscles of the tongue, and they're involved in changing the actual shape of the tongue. All of these muscles are going to be innervated by the hypoglossal nerve. Now, there is another relation that we need to talk about when it comes to the hypoglossal nerve, and that is that this nerve is closely related with the cervical plexus, highlighted here. So what happens is, the anterior ramus of C1 and C2 will join the hypoglossal nerve and travel with it to innervate the genioglossus muscle. A meningeal branch that come off from the sensory spinal ganglion of the spinal nerve C2 might also travel along with the hypoglossal nerve, go through the hypoglossal canal to help innervate the dura mater in the floor of the posterior cranial fossa. Now, when you look at this image, you will also see that fibers from the hypoglossal nerve go towards the superior root of ansa cervicalis, which joins the inferior root of ansa cervicalis from C2 and C3 to form a nice loop here, the ansa cervicalis, which is a part of the cervical plexus. Alright, so that was everything I had for this nerve. Here again you see the scheme for the hypoglossal nerve. It's just schematic, not exactly anatomically correct, but I hope it will help you gain a good understanding of this nerve. So we now covered the hypoglossal nerve, which is the last of all the cranial nerves in our cranial nerve playlist. In the next video, I will quickly go through the schemes of each cranial nerve, kind of unite all of them in one video, so you have them all in one place in case you need to memorize them. Thank you so much for watching another one of my videos. If you enjoyed, learned something from it, please remember to like, comment your favorite moment, subscribe, turn on those notifications. If you're looking for other ways to support, go ahead and check out the link in the description box. Have fun y'all, peace.